Hello and welcome to the Lloyd and Ardis Peterson Cancer Symposium. I am Abigail Shopper and I am the Cancer Center social worker here in Albert Lea, and I will be moderating the event today. The symposium comes from the generosity of Lloyd and Ardis Peterson Family Foundation, who wish to honor their parents in the community where they lived and worked while simultaneously recognizing the quality of care they received from the medical center here in Albert Lea. The Petersons were born, raised, and made Albert Lea their home until they passed away. Lloyd in 1973 and Ardis in 2001. Both believe strongly in being an active part of the community and in giving back both with their time and money. In continuing their wish to give back to the community, they established the Lloyd and Ardis Peterson Family Foundation, with all grants directed to the Albert Lea area. As both were cancer patients, the Peterson family, Valerie Cones, John Peterson, and Stephen Peterson, along with Mayo Clinic Health System, Albert Lea and Austin, created the Lloyd and Ardis Peterson Cancer Education Symposium. We want to thank the Peterson family for their generosity to provide cancer education in Albert Lea and surrounding communities. This year, due to COVID-19 not being able to gather in person, we have chosen to do a Zoom webinar. And again, we thank you for joining us, and we hope to have an in-person event again next year. A reminder to use the Q&A post at the bottom of your screen if you have any questions at any point during the webinar, and we will have a time to answer those near the end. And just a reminder, the webinar will be recorded as well and will be available for viewing after we are done with today's presentation. All right, up first is Sydney Shoney. She is a nurse practitioner in the Department of Radiation Oncology at Mayo Clinic here in Albert Lea, Minnesota. Sydney is an instructor in radiation oncology in the College of Medicine. She has a doctorate degree as a nurse practitioner, graduating in 2013, with her master's degree as nurse practitioner from Viterbo University, and then in 2015, completing her doctorate at the University of Wisconsin-Milwaukee. She is an oncology certified nurse since 2009 and maintains her certification requirements for medical oncology. Sydney has been at Mayo Clinic for 13 years, working first in medical oncology, and the last 7 years have been in radiation oncology. Sydney's clinical interests include oncology, survivorship, and palliative care. Sydney was born and raised right here in Albert Lea, Minnesota, and after completing her training, she and her husband have returned to the Albert Lea area. They enjoy raising their family in the community setting, and Sydney feels quite privileged to continue to serve the patients of the Albert Lea community. Sydney's going to share some updates about the Cancer Center here in Albert Lea.
Thank you, Abby. That was a nice introduction. So I'm just going to talk about the Albert Lea Cancer Center and give you some updates. First, I'm going to kind of give you a little virtual tour of what we have. This is a presentation of what the Albert Lea Cancer Center looks like. On the left-hand side is our entrance where we did have a remodel about 2 years ago to add the fireplace and to have the patients and visitors come prior to their appointments. And then in the right-hand side is the chemotherapy suite where a lot of our patients receive their infusions. So updates for the year of 2020 include many things despite what we've been going through. In January, we did add Abby Shopper. She is our social worker. She assists in medical oncology and radiation oncology. She's been an excellent asset to our patients and staff by giving them a higher depth of care. She helps with those who are struggling emotionally throughout their care journey, as well as helping us find financial resources for our patients. She's also assisted us with staff by helping us understand more about the patient's life story and where they come prior to their diagnosis. Also this year in March, we did a big event with colon cancer awareness where we had an inflatable colon come, and we had some healthcare providers present on colon cancer awareness. In April of 2020, we began offering virtual visits. These include audio and virtual options, and this has helped us keep our cancer centers safe for patients and family during the COVID pandemic. Another update I'd like to discuss is that we continue to have many research trials available. At this time, we have about 20 research trials available at the Cancer Center in Albert Lea, and a lot of these are utilizing resources with combining Mayo Clinic with the U of M resources. We also have an education update. We've started the process of offering education through the portal. These will be sent to patients online through booklets and videos. And the Cancer Center newsletter, which is called The Happenings, has also been sent to virtual options. This does give access to the education classes that are being taught at the Rochester Cancer Center. So our patients have had benefit from the COVID pandemic, in which they're able to attend these classes without physically going to them in Rochester. For chemotherapy updates, the nurses are continuing with their education credits as required and continue to offer care on a regular basis. A lot of our patients have providers in Rochester, and if they would like to receive their chemotherapy infusions in Albert Lea, we do recommend that they talk to their provider if they would like to receive the care. So we are still doing a lot of things at the Albert Lea Cancer Center. A lot of benefits have come to us by being able to offer a lot more care. So thank you, Abby.
Thank you, Sydney, for sharing those updates with us. I am going to share a little bit about my background and talk a little bit about the Freeborn County Relay for Life. So like Sydney said, I joined the Albert Lea Cancer Center in January of this year. I received my bachelor's in science and social work at Wartburg College in 2017. I immediately went on to receive my master's degree at University of Minnesota State Mankato in 2018. From there, I started at the Mayo Clinic in inpatient oncology and worked there for about a year and a half before transferring over to Albert Lea here. I have extensive background in Relay for Life, dating back to when I was a child and assisting my parents on their teams. I was a committee member and had my own team as a young teenager, and this last year joined the Freeborn County Relay for Life committee, and very excited to announce this year I will be the committee chair. So this last year in August, we had a drive-through Relay for Life event at the Freeborn County. We did it out at Edgewater Park. Given the COVID situation, we wanted to make sure we still did something to honor cancer patients, past, present, and future, and make sure we're still fighting for that cure. So we did a drive-through event out at the park and had a great turnout. Currently this year, we are still actively working on finding a date and a place to hold it, and are very hopeful to have a normal Relay for Life this coming summer in 2021. As always, we're always looking for people to be on our committee and for community connections for the Relay for Life. So if that's something that you're interested in, please feel free to reach out to myself or Sammy Jo, who I'm introducing next. All right. So speaking of Sammy Jo Helmers-Nelson will present next on the American Cancer Society. Sammy Jo is a senior community development manager with the American Cancer Society. She and her husband have two beautiful daughters that they raise in Dunno, Minnesota, where she is a volunteer firefighter and first responder. She has volunteered with the Relay for Life since she was in high school when her grandma was diagnosed with cancer, and she has never looked back. Sammy Jo is going to share some updates from the American Cancer Society, ways to donate, how our donations are used, and how you can get involved. So Sammy Jo.
Thank you, Abby. let me just get this pulled up here really quickly. So as she said, my name is Sammy Jo, and I have been working with the elderly area for about 3 years now, and it has been a great blessing getting to know everybody in Albert Lea and Freeborn County. So I just wanted to talk a little bit today about what we are doing at the American Cancer Society, even with the pandemic that we have going on right now. So one of the biggest things that we have is that, cancer hasn't stopped, so neither have we. We are continuing to attack cancer from every angle. Right now in Minnesota, we have 14 research grants that are taking place at the University of Minnesota, at the Mayo Cancer Center, and also at the Hormel Institute in Austin. So these research grants that we have going on right now in 2020 are totaling over $8 million. So that is a good part of where the funding to the American Cancer Society goes, and they are absolutely integral to improving our future so that we can reduce the rates of cancer and to make things just be so much better for our current cancer patients and hopefully to reduce the impact of cancer in the future. Another thing that we are really focusing on right now is trying to get back into resuming cancer screenings. When COVID started, we had about an 80% rate of people that had to reschedule their screenings, also to reschedule just their regular cancer treatments, which is absolutely understandable for what we were going through. But now, several months later, we have so many patients that are just not getting back into the hospital settings because they are just fearful of everything that we have going on, and understandably so. But we are really needing to get back in so we can get those routine cancer screenings completed so that we can catch things at an early stage before things get worse. So it is very important that we are continuing those routine screenings. And, if at any time a family member, friend, or yourself, is wondering what to do, there are so many options available now. I know with Mayo Clinic as well that, we can do, a lot of your clinic visits can be done virtually, and then when we have to get those screenings that need to be done, we just need to try to make sure we follow the safety precautions in place to get those going. And then another thing that we are very, very focused on is advocating for our survivors and our caregivers. This has been a very trying time. Cancer is hard enough the way it is, but to try to have to face it alone is something that we never imagined. Honestly, that's one of our key things is that, when you fight cancer, you're never alone. And it has been very hard for a lot of people this year. So we're doing what we can to make sure that we are keeping cancer at the forefront of our legislators' minds so that they know that as much as COVID has really changed things, the need for cancer patients to be top of mind has not. So we are doing everything that we can to continually make sure that they know we are here and we are not going away, because we need to make sure we have access to care and that we have the treatments available to our patients. COVID-19 has definitely caused the isolation and delays in treatment. So we are doing everything that we can to make sure that we can be with our patients, our volunteers, our donors, everything that we can do to try to make that a little bit better. With the change in times, we have seen so many more Zoom and webinars and things like this. And so that's something that we have really kind of adapted with the times as well. So now you can go to cancer.org and find a plethora of resources that are available with everything possible that you would need to know about your cancer diagnosis or your family members or friends. Also now, if you go to cancer.org/coronavirus, you will have resources that are aimed specifically for what to do, tips to ask your doctors, just different safety measures, making sure that we're doing everything we can to get them handled in a way that is best, because we do know that most of our cancer patients are definitely immunosuppressed, and so we need to make those extra precautions. We also have video chats that are available now. So if you are isolated and unable to be out with friends and family and you're just feeling lonely and you need to see somebody face to face instead of just over the phone, we do have that option available so that they can, hop on their computer or their phone and they can speak to somebody 24/7, 365, whether it's Thanksgiving, Christmas, or just a random Thursday. So you can have that face-to-face interaction with a trained specialist, either on our cancer.org or by calling our 800 number, which is 800-227-2345. So that is definitely something that we have found to be a huge improvement. As human nature, we just need to be able to have people that we can interact with, and that interaction is so important in the journey. So right now, you know, the American Cancer Society has been around for 107 years, and we have had some amazing accomplishments. And it's thanks to donors and volunteers. We would not have been able to do any of it without you. But for the first time in that 107-year history, we're really struggling. COVID-19 has obviously drastically decreased the impacts of funds that we have, and we're really asking for help from those so that we can be able to keep this at the forefront. So, you know, ways you can help is you can donate, and you can do that by doing your Relay for Life in Freeborn County that Abby talked about there. You can join a team, join our committee, and just attend our events. You know, they are very important, you know, for the financial aspect, obviously, so we can continue cancer research and having the programs available to patients, but also because it is just an amazing community to get involved in. I have been a part of Relay, like Abby said, since I was little, and I lost my mother, unfortunately, to cancer last year. And the community that you get from the American Cancer Society and the Relay for Life is one that is just beyond amazing, and they help you really get through things when things get tough. So please know that, you know, we are always here to help however we can. You can always reach out to myself, any member of the Freeborn County Relay for Life or the American Cancer Society at any point in time. So I just want to say thank you, Mayo, for including us, because truly we are stronger together. Thank you.
Thank you, Sammy Jo, for that great presentation on the American Cancer Society. Moving forward to our keynote speaker, it is my great pleasure to introduce Dr. Okuno. Dr. Scott Okuno is a medical oncologist at Mayo Clinic. He graduated from St. Olaf College and went to medical school at the University of Illinois at Chicago. He did his internal medicine residency and hematology and oncology fellowship at the Mayo Graduated School of Medicine. He is presently chair of the Division of Community Oncology, chair of the Department of Oncology in Mayo Clinic Health System Northwest in Eau Claire, Wisconsin, and professor of oncology in the Division of Medical Oncology at Mayo Clinic. Dr. Okuno is going to present today on how to remain focused during the time of change.
Well, thank you for the invitation and opportunity to speak today on a very important topic of how to remain focused during these changing times. I assume everybody can hear me okay, which is great. And it just reminds me that when the Cancer Center was built in Albert Lea, I do remember being at one of the first inaugural visits there to talk about the opening of the Cancer Center in Albert Lea. So this is almost full circle, coming back almost 25 years. So this is exciting for me. So today I'd like to remind us that we are in a mindset of COVID. And it's very, very hard, and it's hard to stay focused when everything is revolving around COVID. We also know that a lot of what we do today is dealing with the masks that we have to do, and there's changes with that. We have different types of masks that we would need. There's been a huge amount of change in our society. We've had to deal with the CARES Act when the COVID hit initially. We also have to understand that there's a huge amount of the unemployed people as well that still, although some haven't come back, it's still a big problem. We also know there's a lot of social unrest going on, and it's hard to stay focused. We remember George Floyd in the Twin Cities, and then we also remember Del Richo, which was the hurricane that came in through Iowa, affecting all of those individuals there. We also remember that there's a huge amount of fires that are going on in the California and Colorado area, And that takes our attention away and at times distracts us. We also know that there are protests that are going on all the time. This was in St. Paul about a month or so ago. More recently, we realized that there are political things that distract us as well, and it's hard to stay focused. Clearly, the debate was the first one was quite entertaining. And then more recently, with the elect of Biden, there are still changes that are going on with that. So there's a lot that has been going on, and it's very, very hard to stay and remain focused. But what I like today is to focus on three things. How to remain focused in the area of unknowns, how to remain focused when we get fatigued of doing the same thing over and over again and being forced to do things that we didn't like to do. And then the last piece is how to remain focused in a time of change. Many times it feels like we're all on a roller coaster. As a patient, you might be up and down. There'll be some good days and some bad days. As a caregiver, you might be feeling well, but the care that you're providing for your loved one might not be doing well, and you're on the roller coaster. And as a healthcare provider, we also feel like we're also on the roller coaster, not only for our patients and their families, but also what we actually do in the workplace. Clearly, we can't focus on everything in this presentation, but I'd like to focus on the three aspects. What can we do with the healthcare provider of unknowns, fatigue, and change in relationship to the patient, caregiver, and us? Clearly, society is a big thing, and the healthcare system that supports us is also important, but I'm going to look at the lens through those three individuals. Just as a background, my lens that I look at the world is that I did grow up in the suburbs of Chicago. I did go to St. Olaf College, and there I did meet my wife, and our three daughters all graduated from St. Olaf. So I do have a very keen interest in St. Olaf and Minnesota. And if I didn't come to St. Olaf, I wouldn't be here at Mayo Clinic because I wouldn't have met my wife at St. Olaf. Actually, my wife is from Casson Manorville. So her and I basically grew up my adult life here in Minnesota. But the perspective is that at St. Olaf, they train us not to be good at anything, but to be good at everything. I think that's the lens that I look at life. I was fortunate enough to stay at Mayo Clinic, get my training at Mayo Clinic, and there we have a huge amount of resources and opportunities, which has been great. And for the last 25 years, I've really spent my whole academic career dealing with sarcomas. Sarcomas are rare tumors. They only occur about 1% of all cancers. And the motto for the sarcoma is the sunflower. And I was able to take a picture of this outside of Nelson, Wisconsin. So my perspective has been very liberal arts, very broad-based. However, spending time at Mayo Clinic and doing sarcoma has been very focused. However, in my new role, I do oversee the Mayo Clinic Health System, and specifically our Division of Community Oncology. In the Division of Community Oncology is a group of oncologists that practice in the rural community, mostly in southeastern Minnesota, southwestern Minnesota, northwestern Wisconsin, and southwestern Wisconsin. And the part that you and us are always looking at is the area down here in Albert Lea. And I purposely put this in here. Rochester is very small. Although they have a big cancer center here at Mayo Clinic, we are practicing here in Albert Lea. And what does that mean for us, and how do we relate to that? So yes, we do cover a large region here in the oncology realm, but we want to focus on individuals, caregivers. We also want to take care of care providers in this region and our patients that live in this region, hopefully never needing to go to Rochester, but spending most of their time here in Albert Lea. Many times it does feel like we're getting charged by the bulls, run over by the bulls. And I think that's how we feel a lot more recently than ever before. As a healthcare provider, I think we feel as though that we're being overrun with activities regarding COVID, doing things that we never would have in our imagination ever thought of. As a patient and a family, we do know that the distances become challenging. We're told to be 6 feet apart. We're told not to visit our loved ones, not to visit our children or grandchildren. It is hard, or the friends and families that we need that support. However, I think there are opportunities that we can and have used and pushed forward that we never did in the past. And I'll spend a little time talking about new therapies as well. The part that we sometimes forget, actually, is the burden that our caregivers of our loved ones have. They wouldn't change it in the world, but we have to realize that there's a huge amount of burden that the caregivers, families, or friends, or daughters or sons that take care of the patient. And we can't lose track of that. So we focus on our healthcare providers. I'm always reminded that this here at Mayo Clinic, and what we practice in the Mayo Clinic health system as well, is the father, Mayo, and his 2 sons. And they realized very, very quickly, and I know it's been shared by Sydney and Sammy as well, is that no one is big enough to be independent of others. They knew that in order to succeed and to provide the best care, that you needed to be collaborative and rely on other people. Here at Mayo Clinic, including the Cancer Center, we have huge amount of resources to allow us to support us. All of us does our part for the greater good of the whole. And that goes back to, why are we here at Mayo Clinic? Why don't we use another healthcare system? Well, I think one of the things that we realize is that the mission, what we aspire to do at Mayo Clinic and Mayo Clinic Health System, is to inspire hope and promoting health through integrated clinical practice, seeing patients, taking care of patients through education, and through research. And you heard about research activities as well from Sydney. Our vision is that we want to continue to connect and cure in a global authority and to be a world authority. But in reality, we want to be the world's authority in Albert Lea so you can experience that. And then what do we wake up every day with? What can we focus on? Is it tangible? Well, it's the primary values. And the primary values in Mayo Clinic continues and will never change. The needs of the patient comes first. So as a patient, as a caregiver, and as a healthcare provider, if we continue to focus on what is the most important thing, even though we might be going up and down on the roller coaster, it allows us to level set and keep our eyes in the right area, that the needs of the patient comes first. And I think that is going to help us ride through the storm, because there have been storms in all of our lives. This is not the first storm that we're going to see. There will be more to come, and that we're going to have to rely on others. So we might say back in January and February, it was calm. We had peace. Well, it wasn't calm and peace back in January and February before COVID. There was change. This is a photo taken from our cabin up north in Hayward. This is a color photo, actually, but you see how grim and gray it was, but it was peaceful. And I always like to look at this picture to kind of re-level set myself to say, yep, there's this inner peace and calm. Because you know that anytime we have peace and calm, the peace and calm happens right before the storm. And then clearly in February and beyond, the storm did hit. So what are the opportunities for our patients? Well, I think one of the things is, although it's quite unnerving as a healthcare provider to keep track of this, but in 2019, there were 48 new drugs that were approved by the FDA. 48. That means roughly 1 or 2 a month. Boom, 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 coming out. Maybe 3 a month. I can do my math pretty much. However, that means that all the healthcare providers have to keep track of 48 new drugs plus all the old drugs. So this has been a challenge for all of us. And the part that's exciting for us as healthcare providers for our patients is if you look carefully at what percentage of those were basically oncology drugs in 2019, about a quarter of them were cancer drugs of the 48. These are new drugs that were not available for our patients or for you prior to 2019. And in fact, over the last 5 years or so, you can see that the vast majority of the new drugs that are coming out are for cancer patients. We also have to realize that some of our patients have solid tumors, what we call oncology, but there are also hematological cancers and drugs as well. And if you look in 2019, 15%, so over half, if you add them up, of the new drugs that are available for doctors, nurses, nurse practitioners, PAs to use, has been basically oncology drugs. So that is the exciting part for all of us. And part of the reason why we have new drugs is the research that goes on. And as Sydney said, we do have research clinical trials that go on in Albert Lee. And we do have a group of studies that are specifically designed for the rural community cancer practice in southeastern Minnesota, northeastern Minnesota, or wherever outside the metro area. So I'm really excited, and I think all of us are excited that, yeah, we're having more drugs that are going to be available. Not only new drugs, but how to combine them, when to use them. The problem for us as healthcare providers is we're needing to know all these drugs. We know how to use them, when to use them, all the side effects. So there's a huge amount of burden that we are looking at just trying to keep track of all this so we can ultimately help our patients. The needs of the patient comes first. So some of the challenges that we do see oncology in the rural Minnesota area is the distance, the cost, and the infrastructure. And these are changes that have gone on, and how do we handle that? Well, remember, the lens that we're looking at is from the patient, their health, their caregivers, and us as healthcare providers. And you've heard that we have pivoted very quickly in order to provide care without the patient having to come into the cancer center, to provide care without needing to go to Rochester. And that means, yeah, we've done Zoom, we've done FaceTime, we've done a million opportunities to allow that to happen. That was the vision that we had in 24, 20, and 30, but we had to quick get up to speed, and that's something that we have done, and hopefully you'll feel comfortable of us doing telemedicine through a distance. There are some advantages. Some of the advantages is that the family members don't have to take off work to drive mom or dad to the appointment, drive them to Rochester, etc. They can do that from the luxury of their home, and many of the caregivers actually can zoom in the same call as we have with the patient, and the caregivers at work, and we're doing the telemedicine. So it's a beautiful opportunity. And because of it, it will decrease the cost and the burden of our family and our caregivers and their caregivers. However, just like anything, there is infrastructure. We're not always good at new things. Some of us might be better than others, but clearly to change from a face-to-face, coming in, driving in, taking off of work, and now doing everything electronically, there's some opportunities that are challenging. Just like me trying to get the right screens to work here, although we do this every day, there are going to be little hiccups along the way. We're patient. We allow that to happen. We allow research to occur. There are new processes when the patient's physically not here that we have worked out, but this has changed. And I think one of the things we look at is COVID, although it's a nasty disease and still a nasty process, is a blessing. It allowed us to jumpstart where we needed to be and should be in relationship to providing oncology care in the rural Minnesota area. I would like to end and spend some time talking about our caregivers. We know that the caregivers, many of you out there, have certain things that you never want to tell your loved one who's going through cancer about, but I'm going to give us that voice today. As a caregiver, we do know that the vast majority of the caregivers of the patient are spouses. It's not uniformly, about 70% or so are the spouses. In communities, however, we do know that sons, daughters, grandchildren, sister-in-laws, brother-in-laws, you can imagine it, are also helping to share the responsibility of helping care. If the spouse is not there, we know the offspring are. And that's a burden. Why? Because a lot of the offspring have lives of their own. They're trying to juggle remote distancing learning for their children. They're trying to deal with everybody in their home and not going to school anymore. So there's a lot of that going on. One of the things we do know is that caregivers tend to be more women than men. Now, I'm a man, so I have to be careful here, but we as men can be compassionate, loving, caring, but a lot of times we can be short, abrasive, and say, get to the point. So whatever reason, there are more women than men that are caregivers. The part we want to emphasize is that being a caregiver does cause stress, does actually cause physical ailments. Now that's something to think about. My husband's going through cancer. He's the one that's having all that problem. What physical ailments, problems as a spouse, the wife, are going to have? Well, caregivers are more likely to develop heart disease. Spousal caregivers are more likely than others to develop arthritis, chronic back pain, several years after being the primary caregiver of their loved one with cancer. So this is not just an acute problem of medical problems that the caregiver experiences, but it's also the chronic problems that we know about. So when people do study this, they do know that this is kind of what happens. If you look here is a psychological stress 2 months after the diagnosis of their loved one and they're their primary caregiver. 70% experience psychological stress. What's surprising is that 2 years after the diagnosis, still 60% still have psychological stress, and even 5 years after the diagnosis of their loved one, 40% almost are still having psychological stress. Medical issues go on as well, that these are not just acute events after 2 months, but caregivers themselves have medical problems that persist even well beyond the initial diagnosis of their loved one. They have impairment of their activities themselves, 50% after 2 months, that still linger on, a quarter of them afterwards. And the part that we know, and Sam talked about the cancer, American Cancer Society and resources that are available in the Cancer Center to help out with this, but we do know that even though this might be a little bit knowledgeable, 20% are still having financial concerns of their caregivers 5 years from the diagnosis. So this is something that we as healthcare providers, and I think as a patient, I think can look to the one that's taking care of you and say, thank you. So as caregivers, I think many of you did not volunteer for this. Many of you did not have training specifically for this. So you hopefully feel unprepared, but you are prepared. You are feeling overwhelmed, very rightly so, but we have support because we're a team. We can take care of it. And when asked, all the caregivers would say they wouldn't change a thing. So as we look today and we end up how to remain focused, well, the main focus has always been the needs of the patient comes first. If we can rise above that and remember we're doing it for the right reason. As care team members, healthcare providers, we're not alone. We have support. You have a huge amount of resources in the Cancer Center to help support your patients, so this is important. But also reach out, talk to your individuals. We're busy, we're distant, but we're all available. As patients, you're not alone. We have great new treatments that are available. Hopefully some of those treatments can improve the quality of life, hopefully improve the longevity of your life. And as caregivers, we all know that we truly, truly appreciate all the efforts that you're doing as caregivers, and we do recognize the burdens that you are going through to provide that care. So with that, I end, and I know we'll have time for questions and comments, so I appreciate the time and the opportunity to talk about how cancer in this time of COVID times is tough, but I think we can work together and get through this one day at a time.
Thank you so much, Dr. Kuno, for your great presentation on staying focused in this time of unknowns and fatigue. Again, thank you to all of our presenters today, Sydney and Sammy Jo and Dr. Kuno. We will open it up for any questions. If anybody has a question, go to the bottom of your screen and there's a Q&A box and you can ask the question there. Oh, it looks like I have one question here. What types of cancer visits are able to be seen virtually? I'll have either Sydney or Dr. Kuno go ahead and answer that one.
Sydney, I'll let you take that from the beginning.
Okay, thank you. So the question is, what type of visits are able to be seen virtually? So these are done by a case-by-case basis. The COVID continues to change who and what and where and when. But right now, we can do virtual visits for any return patients. It's important that you have your scans and your labs completed so that we can have a visit that's very beneficial. Also, it's okay to ask. It's okay to call and ask and see if you can have a virtual visit. People that are undergoing treatment should have a physical exam prior, but it's always good to ask, and we can always do a virtual visit followed up by a physical exam if possible. Dr. Kuno, anything to add?
No, I agree. I think a lot of times, if you're unsure, you can start with a video visit. And if a physical exam after that visit virtually needs a face-to-face visit, it's very appropriate then to come into the Cancer Center to get that visit. So it's sometimes hard if you have a lump to figure that out. But if it's a rash, you can easily send us a photograph. You don't necessarily need to come into the Cancer Center, and you can do that. So I think there's a lot of things that we probably didn't even think about that our technology has allowed us to do. So when in doubt, always ask, and I think we can accommodate most reasonable requests to do either face-to-face or virtual.
Awesome. Thank you both for answering that question. I haven't seen any other questions come through. So again, I just want to thank you, Dr. Kuno, Sydney, and Sammy Jo for presenting on some very important topics here today. Thank you to all of our attendees for joining us via Zoom and being flexible in this crazy time of COVID-19. The first 150 attendees that registered and joined the webinar today will be mailed the book, It's Okay to Laugh by Nora McNeary. All attendees will also receive a packet of information materials as well. Thank you to the Peterson family for their continued support throughout the years to provide cancer education to our community. And just a reminder, a brief survey will be sent to all of you in the next few days. Please complete it and help us plan for our future events. Thank you again, everyone who made this possible and for attending today. We hope you enjoyed it.